Estrella Family Care and Aesthetics is a luxury integrated medical practice that does primary care, psychiatry, therapy, Botox and fillers for all ages in the comfort of their home or via telehealth, accepting insurance and cash pay options. Please like, follow, and share our podcast to access the most up-to-date and evidence-based interventions to keep you healthy. Have a blessed day. Hey, what's up, my beautiful people? This is Charles Lariva, Medical Director of Estrella Family Care and Aesthetics. Welcome to an enlightening episode of our podcast. Today, we are going to embark on an essential exploration of primary care and its profound impact on overall health. Today, we'll delve deep into the principles of primary care, common diagnoses and treatments, what to expect in a primary care visit, the benefits of primary care, and who should seek it. Also, the convenience of telehealth for primary care services. Here at Estrella Family Care and Aesthetics, we firmly believe in the pivotal role of primary care in fostering optimal well-being. Our mission is to provide comprehensive and compassionate primary care services, empowering individuals to lead healthier, more fulfilling lives. Now, join me on this transformative journey as we explore the principles and benefits of primary care, who can benefit from these services, and how telehealth is revolutionizing the way we access primary care. Together, let's start this journey. All right, let's talk a little bit about what a primary care provider is and some common diagnoses and related treatments. Now, primary care is the foundation of healthcare, serving as the very first point of contact for individuals seeking medical attention. It focuses on preventative care, health maintenance, and addressing common medical concerns. Principles of primary care. Well, primary care is guided by principles of continuity, comprehensive care, coordination, and of course, patient-centeredness. Now, here at Estrella Family Care and Aesthetics, we would add evidence-based practice with a faith-based perspective. The primary care provider serves as a central healthcare resource addressing a wide range of health concerns and facilitating access to specialists and specialty care when needed. Role of the primary care provider, well, the PCP plays a crucial role in managing overall health, diagnosing and treating common medical conditions, and referring individuals to specialists when needed. They serve as advocates for their patients' health and work to establish a trusting long-term healthcare partnership. We like to think of it a little bit like the quarterback of your healthcare team. Now, some common diagnoses and related treatments. Well, primary care encompasses a very wide range of health concerns and can address various common diagnoses. Here are some prevalent conditions and related treatments. Hypertension, colloquially referred to as high blood pressure, is a common condition that can lead to serious health complications if left unmanaged. Often referred to as the silent killer, treatment may involve lifestyle modifications such as dietary changes, regular exercise, and stress management, along with various pharmacotherapies. Diabetes mellitus. There's diabetes mellitus type 1 and diabetes mellitus type 2. Both are metabolic disorders characterized by elevated blood sugar levels. Management includes blood sugar monitoring, pharmacotherapy, dietary adjustments, and exercise. PCPs also focus on patient education to empower individuals to manage their condition effectively. Respiratory infections. Respiratory infections such as the common cold, flu, bronchitis are prevalent health concerns in the primary care field. Treatment may involve rest, fluids, sometimes antibiotics if a bacterial infection is present. Primary care providers monitor symptoms and provide guidance that is evidence-based for managing symptoms at home or when necessary with pharmacotherapeutic intervention. Skin conditions. Common skin conditions like eczema, acne, rashes can be effectively managed in the primary care setting and may involve treatments such as topical medications, lifestyle changes, hygiene practices, and monitoring symptoms to ensure appropriate healing. Lastly, gastrointestinal disorders. Gastrointestinal issues, including acid reflux, indigestion, irritable bowel syndrome, are commonly addressed in primary care settings. Treatment strategies may include dietary modifications, lifestyle changes, and medication. As you can see by this very laconic list of possible common diagnoses and related treatments in the primary care setting, the primary care provider in the primary care setting is very well equipped to treat a wide range of disorders and problems that you may be experiencing, especially in relation to chronic health disorders or avoidable illness, as we would like to say. I recommend that you find a place that is number one, fostering of evidence-based practice interventions, meaning they listen to you and then they educate you on the best practices nationwide based on reliable evidence such as randomized controlled trials, meta-analyses, etc. Of course, you're also going to want somebody who knows when to pass the ball, so to speak, when they are out of their depth. For example, working with an integrated medical practice has its benefits because not only will you have access to a primary care provider, but you will have internal access to a wide variety of specialists like psychiatry, therapy, vascular specialists, weight loss specialists, hormone specialists, etc. But maybe your primary care provider isn't equipped with that, or you haven't found one yet. Obviously, I'm biased. If you haven't found one, Estrella Family Care and Aesthetics may be the place for you. But if you're comfortable at your primary care practice and they are not integrated, just know that there will be times where you're going to have to be referred to a specialist, and it is 100% appropriate. And in fact, it may be a red flag if your primary care provider is never willing to pass the ball. Now, you may be asking, what should I expect in a primary care visit? Maybe you've never been to a primary care specialist. I would not be surprised. Many of the patients we encounter, and honestly, many of my colleagues, do not see their primary care specialist nearly enough. A minimum, I would say, once yearly would be appropriate. But if you've got some sort of chronic disease that's unmanaged, you may need to be seen as much as quarterly or more. Now, what should you expect? A primary care visit provides an opportunity for individuals to address their health concerns, receive preventative care and education, and establish a long-term healthcare partnership. Long-term with emphasis, because you have to have a trusted relationship with your PCP. Ideally, you're not flip-flopping around between various people. That way you have somebody you're comfortable with, that knows you, that knows your medical history, and could really do some long-term help for you in the long run. Now, here's what to expect during a primary care visit. Number one, comprehensive assessment. Your primary care provider should conduct a comprehensive assessment of your medical history, current health status, and risk factors. This assessment includes discussion about your family medical history, past medical conditions, current medications you're taking, lifestyle habits such as cigarette use, alcohol use, illicit substance use, and any symptoms that you may be experiencing, which in our world is referred to as a 12-point review of systems. Number two, preventative care. Primary care visits often include preventative care measures such as vaccinations, health screenings, and health promotion advice. I will take that a step further, or I should say we take that a step further here at Estrella Family Care and Aesthetics, because all of our PCPs are held to the highest rigor, meaning I, as the medical director, expect our providers to follow all United States Preventative Services Task Force recommendations when it comes to healthcare screenings. There's a mouthful for you, and I challenge you to make sure your primary care provider knows about it. Ask them, what is the United States Preventative Services Task Force recommendations for this visit based on my age? And if they don't have an answer for you, that's a red flag number two. PCPs work proactively to identify potential health risks and provide appropriate interventions to prevent the onset of illnesses or detect health conditions early. Number three, a personalized treatment plan. Based on your assessment, your primary care provider will develop a personalized treatment plan to address your specific health needs. This plan may include pharmacotherapy, lifestyle modifications, referrals to a specialist, etc. The important thing is it needs to be customized, it needs to be based and founded upon evidence-based practice, and it needs to be related to actual assessments and diagnoses uncovered during the visit or by you. In other words, every problem should be paired with a treatment plan bullet point, so to speak. Number four, referrals and coordination. Actually, I want to circle back to the personalized treatment plan really quick, because this is something that is a bit of a, we'll say, pet peeve of mine. So again, I can only speak for our medical practice here. I hold our staff to the highest rigor. But not only do I expect my staff to have a competent, well thought out, comprehensive, personalized, evidence based treatment plan for you that's paired up to every assessment and diagnosis they have uncovered, but I expect them to educate you on the treatment plan using what's called the teach back method. So that means they tell you what the plan is and explain to you why we're doing what we're doing. Why are you taking this medication? What are we going to do when we reevaluate the medication's effectiveness? How long are we going to be doing this? What's the new dose, etc.? Why, and for what purpose? And then I expect them to have you teach it back to them. And this is very important because it helps us ascertain understanding, identify any knowledge gaps or anything that maybe we could have done better explaining, and right away fix any potential problems in understanding of the treatment plan. This enhances understanding and compliance. And of course, it's a team, right? So we need to be able to communicate that to you competently and then make sure that you are understanding it. So yeah, I just that's a pet peeve of mine. So again, I'm biased here at Estrella Family Care and Aesthetics. I like to say, I'd like to think we're the best, especially in regards to this in particular. But if your primary care provider isn't doing that, I encourage you, ask them. You don't have to go with us to be able to advocate for yourself. This is education and information that you could take anywhere to any provider you are currently seeing and ask them, what is my treatment plan? And if you don't get a sufficient answer, ask them, what ICD-10 codes have you identified for this visit, which is clinical terminology for what diagnoses are you treating? Okay, so you're treating XYZ diagnosis. What's the treatment plan for that? And go one by one. If they can't give you a competent, well-informed, evidence-based answer, red flag number 3. Okay, now moving on to number 4. Referrals and coordination. If your primary care provider identifies the need for specialized care or further evaluation, they will refer you to appropriate specialists. Primary care providers play a vital role in coordinating your care and ensuring seamless communication between healthcare providers. That's a lot to unpack. So again, back to the quarterback analogy, your primary care provider is the quarterback of your healthcare team. When you think quarterback, you think planning, you think strategy, you think teamwork, you think competent communication, you think different routes and passes and runs, and with the end goal of scoring a touchdown, which in this case would be positive healthcare outcomes for the patient at hand, longevity, good lifespan, good life quality, etc. Now, that's the quarterback, right? That's the primary care provider. But we have to remember there are many individuals on a football team. There are many individuals in a well-functioning healthcare team. So moving on to a couple red flags, right? You got a quarterback that doesn't want to pass the ball. That's a big red flag, right? Like you got to be able to hand off the ball for a run. You got to be able to hand off the ball for, a pass. You can't quarterback sneak it all the way down the field and expect to have a very good, competent healthcare experience or football game for that matter. So that would be a big red flag, right? Like if your specialist or if your primary care specialist doesn't want to pass the ball to an appropriate specialist when it's indicated, or even if you ask, there really shouldn't be any barrier between you and requesting a specialist. If your provider's got a problem with you asking for a specialist, I would have to ask why, right? Like, obviously the healthcare provider should be able to competently explain to you, hey, we can treat this here. It's well within our purview. Here's the evidence. Here's my suggestions. Do you want to do it? No. You want to see a specialist? Okay, cool. Right? There's no harm in you seeing a specialist for it. But there is harm in maybe saying that you can't, right? Like, at the end of the day, primary care provider has a very wide scope. They've got a ton of things that they're identifying and working with, and specialists are specialists for a reason, right? Me, for example, I'm a vascular specialist. I know things about vascular, arterial, and venous, head to toe, that a regular primary care provider doesn't, simply because they haven't received the training. It's not a ding on them. It's just they haven't received the training, right? It's just hours in. So if you want to see a specialist, number one, ask. Number two, if you're not allowed to even after asking, I would say that's a red flag. Or to take it a step further, if you have never been referred to a specialist, that could be a sign of a red flag, right? Nobody wants a quarterback that thinks they could do it all, right? And here's a perfect example. So again, back to the United States Preventative Services Task Force recommendations for health promotion and health preventative screenings. At a certain age, you got to get a colonoscopy. So unless the primary care provider, is planning on doing a colonoscopy, which is probably outside of their scope of practice, I think they're going to have to pass the ball, right? They're going to have to pass the ball to a gastroenterologist. So that's just one example of the importance of team playing. And again, I'm biased. We're an integrated medical practice here at Estrella Family Care and Aesthetics. We're very well versed in interdisciplinary communication and teamwork. So if you don't have a primary care provider that is, in general taking care of you, or that is integrated, obviously we're accepting patients. We'd be honored and feel blessed to serve you. But maybe you don't want to see us, and that's fine. What I would encourage you to do is hold your providers accountable. And if you are looking for a primary care provider, I would recommend getting one that's integrated, just because it helps with the seamless process. Okay, so moving on to number 5, and our final one for what to expect in a primary care visit for this little segment here is health education. So primary care visits provide opportunities for health education, empowering you to make informed decisions about your well-being. Now, primary care providers offer guidance on maintaining a healthy lifestyle, managing chronic conditions, and understanding treatment options. So really, I did a really good job explaining that to you already, right? So we're thinking teach back method. We're thinking, do you understand the treatment plan? Do you know why we're doing the treatment plan? And then to put some onus on the PCP, has the treatment plan that they created, is it a competent plan, right? Is it based and founded in evidence-based practice and not just their opinion? And key word here, guidance, right? Here at Estrella Family Care and Aesthetics, we put you in the captain seat of your health. We don't try to commandeer your ship, right? Ultimately, you have to take onus. This is your ship to steer. My job and my staff's job, and any primary care provider's job, should be to present you with evidence-based interventions and options for you to take or not take into your lifestyle, right? Ultimately, you are at the captain's seat, right? So that word there, guidance, is important, right? This isn't a dictatorship. They should be presenting you options, and you should understand why and where that treatment plan is coming from. Let's move on to talking a little bit about the actual, empirical benefits of primary care. What can you stand to benefit from seeing your primary care specialist, or at least a competent one? Primary care plays a pivotal role in promoting overall health and well-being. Here's just some key benefits of primary care services. Number 1, preventative care. Primary care focuses on preventative measures, helping individuals identify and address health issues before they become severe. Regular health screenings, vaccinations, and health risk assessments contribute to disease prevention and early intervention. Number 2, continuous care. Establishing a long-term relationship with a primary care provider helps to ensure continuous and coordinated health care. This continuity of care fosters a deeper understanding of your health needs and helps you partner with your primary care provider to monitor your health status over time. Number 3, a holistic approach. Primary care providers and primary care considers all aspects of an individual's health, taking into account physical, emotional, and social factors. Primary care providers recognize the interconnection between physical health and mental well-being, whilst addressing the whole person's needs. Number 4, chronic disease management. Primary care providers play a significant role in managing chronic conditions. We spoke a little bit about some of those earlier, hypertension, diabetes, COPD, etc. Managing those chronic conditions, ensuring regular monitoring and appropriate treatment. We need to maintain clinical inertia. You need to be getting better. They work collaboratively with patients to develop personalized care plans that focus on disease management and quality of life. Number 5, health promotion and education. Through health education and guidance, primary care providers empower individuals to take an active role in managing their health. Education on nutrition, exercise, stress management, and other lifestyle factors contributes to overall wellness and disease prevention. And I barely got through that sentence without laughing, and I'm sure maybe you could guess why. Um, Again, here at Estrella Family Care and Aesthetics, I'm biased. I do think we are the best. We follow evidence-based practice. We're going to listen to you. We're going to give you all that you need and deserve. But what I just said there, it doesn't sound like the very common primary care experience that you're probably used to. That doesn't sound like that could be done in a 5-minute visit, right? National average for, patient load for a primary care provider, 2,000 patients, you're thinking 5 to 7 minutes per patient. They're seeing 50 patients a day. They walk in, they walk out. Your hair almost blows in the wind as they come in and on the door, right? That's not an optimal experience. That's why here at Estrella Family Care and Aesthetics, on average, our encounters are 45 minutes. This does give us ample time to do that education on nutrition and exercise and stress management and why we're doing what we're doing in our treatment plan and what evidence is founded in, right? It's not a knock on anybody else. Obviously, I can only speak for our practice here, but my heart goes out to those individuals because it's like, well, how could you do that, with that kind of workload or with those 5-minute encounters? So, that's another red flag. If you're getting 5 minutes or 7 minutes, or if you're not getting all that education you need and deserve, that's another red flag. You need to pursue something better and something that really you deserve. Moving on to number 6, and the last for today's laconic summation of benefits of primary care is personalized care. Primary care is patient-centered, allowing for personalized care that considers each individual's unique needs, preferences, and goals. Primary care providers work with patients to create care plans that align with their values and lifestyle. So now you know what primary care providers do, you know what primary care is, some common diagnoses, some treatments, the benefits. Uh, Now, how do you know if this is for you? Who should seek primary care? So we're going to talk a little bit about that. Primary care services are essential for individuals of all ages and health statuses. So we could disparage that right away as, if you're human, you're going to benefit from primary care. Um, in the primary care field, some of us like to, say that, womb to tomb, right? So we're going to take care of you the whole lifespan. Um, Here's who benefits from seeking primary care. Number one, individuals of all ages. Primary care providers cater to the healthcare needs of individuals from childhood through adulthood. Pediatric primary care focuses on early detection of developmental issues, immunizations, and health growth and development, whereas adult and geriatric primary care addresses age-specific health concerns and preventative care, and anticipatory guidance, of course. Number two, preventative care seekers. Those interested in preventative care and health maintenance can benefit from establishing primary care services. Regular checkups, health screenings, and preventative interventions can significantly impact long-term health outcomes. Now, I do have to add a caveat to that. Just because you're going to a primary care office does not mean they're going to be preventative minded. Yes, this is the standard. Yes, they should. Yes, 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 and all of these things. Yes, but the reality is just because you're walking into a PCP's office does not mean they're going to give you preventative care. It does not mean that they are going to do what we do here, which is, we're trying to optimize you in your life. We don't want you to get sick. We don't want to be reactive. We want to implement preemptive solutions-based actions to give you the very best health outcomes. So if you are a seeker of optimization, or if you are a seeker of maximization of your quality of life and getting some self-actualization, well, you need to do your research. Again, I'm biased here at Estrella Family Care and Aesthetics. We can do that for you, but I'm sure there's other people out there. Now you know a little bit about what to look for, right? So keywords, holistic, preventative care, education. Make sure they actually have the time to input and invest into you and listen to what you actually want. Unfortunately, in the harried primary care world, if you don't have an actual problem, eyes glaze over, they breeze in and out of the room, right? But I would argue that optimization is just as important as that actual problem, right? That's when we need to intervene, is before the problem has manifested. That's when you're going to respond best. That's when we're going to get the best results. And it's when we could do something that is difficult while it is still easy. Lastly, well, not lastly, individuals with chronic conditions, right? So primary care plays a key role in managing chronic conditions, ensuring regular monitoring, medication management, and lifestyle modifications to enhance disease control and quality of life. If you have a chronic condition, you absolutely must be seeing a primary care provider. I cannot stress that enough. This comes back to clinical inertia. Clinical inertia being we don't want you to be stagnant. We need you to get better. Otherwise, without intervention, you will likely get worse. That's how chronic conditions work. And back to the last note, chronic conditions are mostly preventable. So again, see your primary care provider either way. But if you have a chronic condition already, we're talking diabetes, high blood pressure, hypothyroidism, Addison's disease, Parkinson's disease, kidney issues, any number of the chronic conditions out there. You need to be seeing your primary care provider at least annually and then follow their recommendations from there. And that doesn't even include the specialists that are on board. Of course, you have to follow up with them as recommended. A good rule of thumb, and again, this may or may not apply to you. This is a good rule of thumb that we use here at Estrella Family Care and Aesthetics. At minimum, if you have a chronic condition, you need to be seen twice a year. If that chronic disease is not controlled, we're likely going to see you every month until it's controlled. So, for example, let's say you do have high blood pressure. I don't want to speak about how other practices manage it, but my expectation of my providers is every time you are put on a new medication, anytime that medication is adjusted, it is an absolute must 2 to 4 week follow-up. And that's very important. Number one, did you take the medication? Did you start it, right? We need to check. Number two, are you having any side effects? Number three, is it doing what it's supposed to be doing? Did it do it too well? Now your blood pressure is too low. Did it not do it enough and now it's still high? Or did it cause you to, sprout a tail in rabbit ears? I don't know unless I check, right? So minimum 2 to 4 week follow-up for those things until controlled. So for example, using high blood pressure as an example, let's say you're newly diagnosed, you've been in the clinic 3 times, and every time it's elevated, you've been identified as stage 1 hypertensive. We started you on an ACE inhibitor. So you put on lisinopril, 10 milligrams, and we're going to follow up in 2 weeks. Suboptimal blood pressure regulation. You did not reach our systolic goal for you, which was less than 135 millimeters of mercury. So we're going to raise that to 20 milligrams lisinopril. Bring you back in 2 weeks. Did it do its job? Did you take your medicine before the visit? Oh, you forgot to take your medicine before. I don't really know if it worked. You got to come back after taking the medicine in a week, right? This time, it is controlled. Great. No changes to the medication. You brought your blood pressure log that we asked you to do, and all of those checked out as well. So we're not going to make any changes to the recommendation, but now we're going to talk a little bit about the DASH diet and low sodium, etc., 9-inch plate method, time restricted eating, and all of the other good things that we do for you. And let's follow up in 4 weeks, right? Were you able to do those lifestyle interventions? So what you see here is very high touch, right? You can't have a primary care provider, especially in relation to chronic conditions, that just kind of, I don't know, because I can't even empathize with that kind of treatment, but you have to maintain clinical inertia, right? You can't manage something like this from afar, and you certainly can't expect a layperson to manage it themselves, right? Especially when you haven't competently explained the treatment plan to them. So if you have a chronic condition, long story short, you absolutely must be seeing your primary care provider. Now, further on who should seek primary care, number 4, health promotion advocates. So this is kind of similar to preventative care seekers. So those seeking guidance on leading a healthier lifestyle can receive support and advice from primary care providers. Now, primary care providers empower individuals with knowledge and resources to make positive lifestyle changes, including healthy eating habits, regular physical activity, stress management techniques, and smoking cessation. Number 5, individuals with acute health concerns. For individuals experiencing sudden or acute health issues, primary care is often the first point of contact for timely evaluation and treatment. I did laugh when I said timely, and we're going to get to why. Primary care providers can assess the severity of symptoms, provide immediate care, or facilitate appropriate referrals if specialty care is needed. Now, let's backtrack a little bit. Here at Estrella Family Care and Aesthetics, if you are a new patient, if you are an established patient, I don't care what it is, what specialty, you're seeing therapy, you're seeing psychiatry, you're seeing one of my primary care providers, we're going to schedule you within 1 to 2 business days. That's a big deal, especially in the healthcare world. That just does not happen. That's why, unfortunately, when people get sick, oftentimes they are stuck in an urgent care for 7 hours with a bunch of people coughing around them, and that's where they have to get treatment for their sinusitis or whatever it is, right? That's not how your experience should be going. You should be able to see your primary care provider for those types of things via telehealth, via in-person encounter, whatever it is. You should be able to see your established quarterback for your healthcare team, right? Especially for those run-of-the-mill acute things. So if you're not getting that, you need to find someone who could give that to you. And that goes into that timely evaluation and treatment. There's a wide range of things acutely that a primary care provider is well able to treat for you. So urinary tract infection, bacterial vaginosis, STIs, STDs. You got runny nose. Is it allergic rhinitis? Is it some sort of seasonal allergy issue? Or do you have a viral issue? Do you have COVID, strep throat, mono, etc.? All of those things, acute, you woke up, you don't feel good. Your primary care provider should be your first point of contact, unless, of course, you have an emergency like, shortness of breath, chest pain, etc. Now, moving on, number 6, patients managing multiple health conditions. So for individuals with multiple health conditions, primary care is absolutely essential for comprehensive disease management. Primary care providers help coordinate care and monitor interactions between different treatments, ensuring the best possible outcome. So I would even argue too, not just multiple health conditions, but multiple medication. That's called polypharmacy. If you're taking a handful of pills every day, that's a good indication you got a lot going on, and somebody needs to be on a very high touch treatment plan with you where they are checking in and they are maintaining that clinical inertia, make sure you're getting better at minimum, not getting worse, right? Or understanding what the treatment plan is and constantly checking and reevaluating, pivoting and re-executing a new treatment plan founded in evidence-based practice. And of course, if you have multiple actual diagnoses, that falls into the same basket, right? So if I'm patient A and I have high blood pressure, I have kidney disease, I get chronic UTIs 5 times a year, I have high blood pressure and I am obese, so that's a lot of diagnoses, that's a lot of things that need intervening. Number 7, women's health. Women seeking comprehensive healthcare services, including preventative care, reproductive health, and guidance during pregnancy or menopause, can benefit establishing primary care with a provider who offers women's health services. Those of you who listen to the podcast know how passionate I am about all things hormones, such as menopause for the women, or as I like to say, menopause for the men, because there's really no reason the process of senescence or aging should have you feeling anything less than stellar. There's a lot of things that can be done lifestyle and pharmacotherapy wise to keep you optimized. Again, keyword optimized. I don't want you to have the hormones of a thriving 50-year-old, when you can have the hormones of a thriving 20-year-old and feel that way. So I definitely encourage you, if you're going through menopause, if you're going through menopause, seek help, seek a specialist, hormone optimization specialist, and get that taken care of. Now, here at Estrella Family Care and Aesthetics, our primary care providers are well versed in that. That's not going to be the case at most primary care settings. So for that, I would say you're going to have to go to a specialist. Here, we're unique. We're an integrated medical practice with a luxury perspective, founded in faith and focused on optimization. So that's just what we do. But if you're looking for that, you may need to find a specialist, or obviously come to us. It would be an honor and a blessing to serve you. Telehealth and primary care, oh, so misunderstood, in laypersons and definitely in medical professionals. I don't know why. Telehealth is revolutionary. It has revolutionized the way we access primary care, offering convenience and accessibility to healthcare services. At Estrella Family Care and Aesthetics, we're proud to provide telehealth primary care options to our valued patients, as well as for psychiatry and therapy and Christian life coaching and hormone optimization, etc. We believe there should be minimal to no barriers to you accessing care. And the reality is, people have families, people work, people, don't want to go to the doctor, right? So anything we could do to help bolster some compliance and help you get some access to good healthcare, we're going to do that for you, right? Number one, convenience. Telehealth primary care allows you to connect with your primary care provider from the comfort of your home or any convenient location. This eliminates the need for travel and waiting room times, making healthcare more accessible, especially for individuals with mobility limitations or living in remote areas. Number two, accessibility. Telehealth services ensures individuals in rural or remote areas have access to quality primary care. It breaks down geographical barriers, enabling patients to receive care from providers outside of their immediate area. So you don't have to be confounded to whatever pool is near you, right? You could go to the great big ocean and find the best, right? Number three, continuity of care. Telehealth primary care ensures continuity of care. Back to the urgent care example, obviously here at EFCA, you're going to be seen within 1 to 2 business days, no matter what it is. You're not going to be waiting 6, 7, 8 weeks, right? But at most places, you will be waiting 6, 7, 8 weeks. So you're going to have to go to that urgent care, and they're not going to know anything about you because they have no long-term relationship with you, and you have to go over all your medical history and et cetera. That's if they even ask. So telehealth primary care ensures that continuity of care, allowing individuals to maintain their healthcare routine even during travel or other disruptions or acute illness. It's particularly valuable for patients who frequently travel for work or live in different locations throughout the year. Flexibility. Telehealth appointments offer greater scheduling flexibility, accommodating busy lifestyles. Patients can choose appointment times that fit their schedules, their needs, making it easier to prioritize healthcare needs without sacrificing other important commitments. Number five, comprehensive services. Many primary care services can be provided through telehealth, including routine checkups, health assessments, follow-up visits, medication management, and lifestyle counseling. Some acute health concerns can also be addressed through telehealth consultations. Your primary care provider, any provider, they're trained, right? So there's no reason they cannot operate to the zenith of their potential and their assessment skills and ask the right questions and have you do the right things and do their best to figure out what's going on. It's certainly a lot better than you just not getting seen, right? And if they need to bring you in for an office visit at a later time, then that's what happens. But it still accesses care. It still gives you treatment promptly, quickly, and effectively. Now, telemedicine technology. Telehealth platforms utilize secure and encrypted technology, ensuring patient privacy and confidentiality during virtual appointments. Again, I can't speak for other places, but here we do have end-to-end encrypted technology for those visits. Now, video conferencing and secure messaging enables effective communication between the patient and the provider. Number seven, insurance coverage or cash pay. Our telehealth primary care services are available through insurance coverage or cash pay options, making healthcare accessible and affordable for all. Patients inquire about coverage options or payment plans to determine the best option for their needs, and an eligibility verification is done. Again, we don't want to make this about us, right? We just want to educate you that telehealth can be covered by insurance in most, if not all, or many instances. In worst case, do a cash pay, right? I mean, it's still better than going to urgent care. Finding the right primary care provider. Now that's a big one. I would be remiss if I did not say Estrella Family Care and Aesthetics is a luxury integrated medical practice able to help you with all of your primary care needs, psychiatry needs, therapy needs, Botox, filler, hormone optimization, weight loss, vascular, etc. In the comfort of your home or via telehealth using insurance or cash pay options. But maybe you don't want to be with us. Let's talk a little bit about finding the right primary care provider, what you should be looking for, how to do it. And, we already talked about some red flags. Maybe we'll broach some more. Finding the right primary care provider is essential for establishing a successful healthcare partnership. Here's some tips to guide you in finding the right fit. Number one, research and referrals. Conduct research on primary care providers in your area and seek referrals from friends, family, healthcare professionals. Go on the Facebook page for your neighborhood. Ask, hey, who loves their primary care provider? Who is it? Tell me about your experience. How long does it take to be seen? How long is the visits? Are they nice? Do they listen? Do they have good bedside manner, etc.? Personal recommendations can provide valuable insights into a provider's approach in patient care. At the end of the day, you know, it's very unlikely a provider is going to tell you that they're not good, right? They're going to tell you they're the best in the world. But what I would encourage you to do is look at the fruits of the spirit, look at the fruits of their labor, and hold us to that standard as well here at Estrella Family Care and Aesthetics, right? So, is the evidence-based practice there? Is the teaching happening? Is the education happening? Am I being seen promptly? Am I feeling included in my treatment plan? And all of those things that we're talking about, hold your provider accountable, right? Interview your provider, at that first visit. And you don't necessarily have to make it a Q&A, but fill it out, right? Is this going to be right for you? It's important that you have that peace with that type of decision. Number two, credentials and experience. Verify the provider's credentials and inquire about their experience in primary care. Check if they are board certified and stay up to date with the latest medical advancements and best practices. Again, I can only speak for Estrella Family Care and Aesthetics. You will only be treated by a board certified and licensed medical provider, able to assess, diagnose, treat, and prescribe for all of your needs using evidence-based practice. This is the standard I hold them to, and of course, to the highest rigor and standards of all state and federal regulations. Now, I encourage you to do that, right? A great example is, the pop-up med spas. You see this all the time. Every registered nurse under the sun, that wants a side hustle does med spa, and not in all cases, but in some cases, the highest regulations are not being followed, right? So you're getting a nurse doing Botox, but they've got no provider that has actually seen you, assessed you, created a diagnosis and a treatment plan, and then prescribed the medication that's being injected, right? If they've done somewhat due diligence, maybe they've got a paper medical director on file, but if they haven't assessed you, if you haven't met them, how in the world do they do a diagnosis and then prescribe the medication that's being injected, right? They have not, right? So in that instance, that RN would be participating in something that's outside of their scope of practice. So the credentials and experience, well, it's just not there. They may be able to, do the injection itself, but they cannot diagnose anything, no matter how knowledgeable they are. And RNs are very knowledgeable, but we're not talking about, we're not talking about that. We're talking about certification, licensure, appropriate scope of practice, rigor. That's what we're talking about. So check those things. Do not, especially in the aesthetics world or hormone world, do not budget shop. I like to say value shop. Look for what you need, especially in primary care as well. Number three, communication and comfort. Choose a provider with whom you feel comfortable communicating and building a trusting relationship. Effective communication is essential for understanding your health needs and making informed decisions about your care. We've talked about this in exhaustion. It cannot be talked about enough. It's so important to be comfortable with your primary care provider and have that good firm foundation and rapport. It's going to foster better communication. It's going to foster better compliance and better healthcare outcomes for you and your family. Number four, primary care philosophy. Everybody's different. Consider the provider's approach to primary care, ensuring it aligns with your healthcare needs and preferences. Some providers prioritize patient education and preventative care, while others may have specific areas of expertise, such as managing chronic conditions or women's health, and they focus on that. Again, I have no business talking about any other practice. I can only speak to us here at Estrella Family Care and Aesthetics. we're about evidence-based practice. We're about putting you in the captain's seat. We want you to feel like you have a medical provider in the family for the family. We average those 45-minute encounters. We get you scheduled within 1 to 2 business days. We do have a high-touch approach. We do have clinical inertia. We do use evidence-based practice and teach back methods for education. We do those things, and it's evidence and empirical in all of our care. Wherever you're going or wherever you intend on going, look into that, right? So what is their mission statement? If they don't have one, ask. What are their values? Again, using Estrella Family Care as an example, we're a faith-based company founded on the fruits of the Spirit. So compassion and love and consideration, all of those things are built in. And then again, we do have that forward-thinking mindset with preventative health care and optimization. Number 5. Telehealth readiness. If you are interested in telehealth primary care, ensure that the provider offers virtual consultations and has a user-friendly telehealth platform for seamless virtual visits. Again, I don't know why not everybody is doing it. So if you are looking for a primary care provider or a specialist for that matter, make sure they're equipped. There's really no reason at this point in time in this day and age, and with the technological leaps and bounds that we've had in the medical field, there's no reason that they can't or should not be offering telehealth readiness for you. So ask, make sure they do. As we conclude this transformative exploration of primary care, I extend my heartfelt gratitude to all of our listeners for joining us on this meaningful journey. At Estrella Family Care and Aesthetics, we are dedicated to providing compassionate and comprehensive primary care services, empowering you to lead healthier lives. Remember, primary care is the cornerstone of good health. Seeking regular healthcare support is a proactive step towards overall well-being. Embrace the power of primary care, knowing that support and understanding are always within reach. To schedule a telehealth primary care appointment or in-home consultation, call or text us at 602-699-6171. That's 602-699-6171. Our caring team is ready to assist you in our journey towards better health. As mentioned, you'll be scheduled within 1 to 2 business days. We are in network for many providers for insurance, including Blue Cross Blue Shield, Aetna, Medicare, TRICARE West, etc. And we also have a very competitive cash pay program, $50 for telehealth, $75 for in-service area home visits. May you find the strength to prioritize your well-being through the transformative power of primary care. From all of us here at Estrella Family Care and Aesthetics, we wish you a life filled with vitality, health, happiness, and blessings. Thank you all. I hope you have a very blessed day. This episode has been brought to you by Estrella Family Care and Aesthetics, your community medical provider. We thank you for the opportunity to serve you. It is such an honor and a blessing. Thank you for listening. Please like, share, and comment on our podcast because we love to hear from you. We hope you have a very blessed day. If you need anything, don't hesitate to reach out. We can be reached via call or text to 602-699-6171. or email at info@estrellafamilycareandaesthetics.com or any number of our social media platforms. Thank you and have a blessed day.